Next, we have some practical tips for collaboration with healthcare and welfare organizations. So, startups, please listen carefully. After these speakers, we'll have some quick comments from a startup perspective. Please welcome Jaakko Laukkanen from KaikuHealth, who is our startup judge today. Welcome. May I have a microphone to Jaakko? But first, I give the microphone to Jitendra Kavathekar, Managing Director from Accenture Ventures. Please, can you come up here in the center? Jitendra Kavathekar, Managing Director from Accenture Venture. Here. Can you please give the microphone to Jitendra? So, now it's your time. The stage is yours.
The stage is mine, okay. Good, so thank you. I think I have 2 minutes. So
2 minutes.
Many of you have heard of Accenture. Of course, we're a services company. My responsibility is to run open innovation globally for the company.
Excuse me, sorry. Can you have the microphone
sure, of
really
course.
near your mouth? Because
yes.
Otherwise nobody will hear you.
Yes. So with Accenture, our open innovation program is trying to be a bridge maker between startups and corporates. This is our fundamental mission with the program. And with this, we are in many different countries around the world. We're here in Finland now. We just launched the program. And the philosophy, I'll be philosophical about why we're doing this. Why we're doing this is because the amount of innovation that's happening in the startup world, and of course it goes beyond the startup world, but focusing on the startup world, the value that's being created has such a big impact, such a big potential for what corporates and public sector is doing. But these systems do not come together very easily. That value that's created on one side is not easily translated to the value that it really should have to patients in Finland, or to education, or to these other large programs. And so what we're doing with Accenture is how to be that bridge maker between the two worlds. This is our mission. And of course we have our consulting capabilities, of course we have our system integration capabilities, we have strategy capabilities, we have technology capabilities, we have all these different capabilities. How do we be part of this ecosystem? How do we create a collaborative environment? But beyond this, what's really interesting, and as I'm hearing the speakers that were here earlier, and as I'm learning more and more, Finland is really taking the lead on data is the enabler for innovation. Data is the enabler for progress. And if we think about bridge making, the value of data, how do we unlock the value of data in order to actually have the value that we expect it to have? How do we all become bridge makers to make that happen? That value kind of creation. How are we all bridge makers, all of us? And how, when we do that, how do we create the infrastructures, the architectures, the open architectures, the governance? How do we do that in a way that actually accelerates the progress of that value creation from that data? How do we actually do that? And that's what we're here to try to figure out. That's where we're here to help. And ultimately, I think I'll leave you with this. If I have to give one piece of advice on this, from what we see when we talk to our clients around the world, innovation for innovation's sake is very fun, but it's like eating candy. At some point, we have to start eating some protein and some actually healthy food, because it's very fun to get caught up in the innovation for innovation's sake. It's very fun to get into the collaboration for collaboration's sake. And we absolutely need all that enthusiasm. But ultimately what it's about is find the purpose. And each of the startups here have a very strong purpose. You can just see that very well written on the boards that are here. That is their purpose. Align the purpose to the fundamental mission of what the public sector is trying to do, the areas of concern. Find that alignment. And when we create that bridge and that infrastructure, we would like to see this go at a scale. It goes beyond innovation and actually gets into impact and affecting people's lives. That's what we're here to do, and I'm proud to be here.
Thank you, Jitendra.
Okay.
One thing, please, can you be as quiet as you can when the pitchers are speaking, so we all can hear what they are saying. Thank you very much. Next up is Chief Development Officer Visa Honkanen from HUS, the Hospital District of Helsinki and Uusimaa. Here you go.
Thank you. So my tips for you. The first question you ask from yourself is, A, do you want to help sick people? Do you want ease suffering? B, do you want to become rich? If you answer B, don't bother. If you answer both A and B, that's already promising. But if you answer A, let's start talking. The next question is, do you want money from us? Which means that you want to sell us something. If that's the case, make sure that what you are selling is proven in efficacy and safety. But in the you want to co-develop with us something. You have a great idea or even a prototype already, and you want to further develop it to a product. Then I would say that our hospital is maybe one of the best places to work with. We are Europe's second largest university hospital. We have best results in cancer therapies, in pediatric transplants, in neurosurgery, and in treatment of strokes. And on top of that, we have an extensive e-health platform to work with, and now we have a data lake. You can safely swim with the data without being afraid to get drowned. And in that kind of collaboration, we will be able to do products that will help the patient and the society. And yes, maybe you may end up rich as well. Thank you.
Thank you. Very good. That was Visa Honkanen from HUS. Next, let's give the microphone to Ossi Laukkanen, Director of Mehiläinen. Please welcome Ossi Laukkanen.
Thank you. And I'm over here, if you're wondering.
He's over there.
Yeah.
You have to jump a little so everybody sees.
No, I'm tall enough. Maybe
okay,
people
good,
will see.
Great. Ossi Laukkanen, here we go.
Okay, thank you. First of all, we're really interested of the startup scene, and we're actually involved with the Accenture Accelerator program. And I've been spending more time at Maria 01 than at my own office this fall. I have been seeing lots of pitches from startups and scale-ups, and some of them are really good and some not that good. But based on this experience, I have a few tips. The first thing I think is that you have to recognize who's the customer. Is it the main partner or is it the end customer of the partner? And this is important because you need to be prepared with your business case. In order to understand the business models and the kind of the pricing system in the partner company, that kind of allows you to learn and modify the pitch. That's probably the most important thing. I have a few good examples of startups we're working with. First of them is e-commerce pharma, which allows us to create digital pharmacy in our own applications. And the next thing is UApp. We're piloting wellness programs, and that's a good example how a startup can listen and kind of learn and modify the concept and the whole business case after the conversations. And Meru Health is another one, which is example of also listening and hearing and modifying the concept. Thank you.
Thank you, Ossi. And then we will continue. The minister talked about Testbeds, and now we will hear about Testbeds from project manager Timo Alalääkkölä from Oulu University Hospital. Where is Timo Alalääkkölä?
I'm
He's
here.
over there.
Here.
Great, and your time is starting now. Here we go.
So, I think the best way to tell you about Oulu Health Labs is to tell you how we got started. When working in development projects in hospital, I got constant messaging from companies saying that it's difficult to test healthcare applications in Finland. It's difficult to get healthcare professionals' feedback. So we thought, what if there would be an affordable solution for this problem? And then we ended up establishing Testbed called Oulu Health Labs. It's a testing and development environment for companies to bring their prototype products or services tested by healthcare professionals in authentic environment. Our Oulu Health Labs environments cover the whole chain of social care and healthcare, combining university hospital specialized care, basic level healthcare in city of Oulu and social care, even the future professionals in form of students. Special thing in Oulu is the digital testing platform, which brings hospital information system with realistic interfaces for test cases. For startups, we are the testbed for every phase of your research and development. Our prices start from €500. That would be fast-track feedback for your idea. We have executed more than 70 cases already, and our doors are open for more. So, if you like to bring your product or service concept to be tested in Oulu, so please bring it to us. We are here today to talk with you more and get you started with the testbed cooperation. Thank you.
Great, thank you, Timo. So now we heard the pitches. How did this all sound to someone from a startup? Jaakko Laukkanen from KaikuHealth, what would you say?
Thank you, Baba. I think it all sounded very good indeed. In the collaboration, we need all startups, we need hospitals, we need corporations, and we need governmental bodies to work together. Just a few ideas I would like to share is that hospitals could really consult on startups even at an earlier stage when they are forming their strategies. Startups are where innovation happens, and they have the freshest points of view on many things. Also, making these strategies public as early as possible will help in speeding up that development and innovation. And then, from a startup perspective, also funding is vital, and waiting times can be deadly. So I wish that corporations and hospitals, governmental bodies will find ways to fund startups while they are developing their new solutions.
That's very crucial, I think. Thanks, Jaakko. Let's give a round of applause to our wonderful speakers. You made a great job. Congratulations. Thank you.